Good morning, everyone. Today I'd like to present my study on retrospective analysis. Sir, can we reset the timer, please?
Okay. Timer reset कर दो please.
Good morning, everyone. I'd like to present my study on retrospective analysis of scleral repair for MSICS wound dehiscence. I have no financial interest in the study. As we all know that cataract surgery has evolved from ICC, ECCA, MSICS to phacoemulsification, where the wound length has decreased and the wound strength has increased over time. Manual small incision cataract surgery is still very widely performed in our country as it is machine independent, cost effective, sutureless procedure which gives good post-operative results. But the trend is now shifting towards phacoemulsification because of the new government schemes, better and affordable intraocular lenses and awareness programs. In the Indian scenario, the old age population is on the rise, that is increased to 5 to 6 times over the last 60 years, and they are highly susceptible to falls and injuries. As reported by Cloak et al., one-third of the open globe injuries were cataract wound ruptures. The purpose was to study the surgical wound dehiscence following MSICS and analyze the predisposing risk factors of wound rupture and visual debility. Objectives were to study the profile of the patient's reasons for trauma and visual rehabilitation. It's a retrospective observational study in which 421 open globe injuries were evaluated over 2 years and 79 patients with scleral wound dehiscence were included in the study. The patients were diagnosed on slit lamp examination, confirmed intraoperatively on microscopic examination. The patients were evaluated based on demographic, trauma details, and management and outcomes. We came up with the results that 70% of the patients were more than 60 years of age. There was no gender predilection. The traveling distance was found to be less than 100 kilometers in 67% of the patients, and which may lead to improper treatment on first presentation outside if they are living far away, and late presentation may lead to poor visual outcomes. Cataract surgery to presentation was evaluated, and we found that 20% of the patients reported to us within 6 months of cataract surgery, and 42% reported more than 4 years after cataract surgery. There are case reports saying that wound dehiscence can happen even after 20 years of cataract surgery, so stability of the wound is the main criteria. The injury to presentation was evaluated. We found that 87% of the patients reported to us within 1 week of injury. Injury being external blunt injury in 43%, cattle or animal injury in 23%, and self-injury or fall in 19%. Lens status was evaluated, and we found that IOL can be dislocated in 55. IOL was dislocated in 55%, and 16% IOL was expulsed outside. The severity of the dehiscence was categorized based on these characteristics, and we found that 75% of the patients had severe dehiscence. Posterior segment was involved in 56% of the patients, whereas 51% were left aphakic. Vitreoretinal surgery was required in 28% of the patients. Presenting vision was compared to final vision, and we found that we were able to provide good visual outcome, that is around for 30% of the patients we were able to provide better than 6/60 visual acuity, and poor visual outcome was found in around 30% again, with perception of light vision or no perception of light vision. When severity of dehiscence was correlated with age, type of injury, duration from cataract surgery, and final vision, we found that it was only significantly correlating with final vision. We found 2 cases of wound dehiscence in phacoemulsification during the period, which was because of blunt trauma with clinical features of hyphema and iris prolapse, where IOL was stable, and we were able to provide good visual outcomes for these patients. The literature was reviewed, and we found that a study by Cloak et al. Compared ECC versus phacoemulsification in 63 patients over 9 years, 63 patients of wound dehiscence over 9 years. And another study in which ECC versus phacoemulsification was compared, and they found 76 patients over 15 years in Taiwan. The limitations of our study were that the data related to the strength of the cataract wound was not available with us, which may need prospective study in the future. So I would like to conclude saying that as doctors, we should aim to provide a stable wound MSICS surgery, especially in the elderly population. And for patients, if there is any trauma, their early presentation should be emphasized on in follow-up presentations for these cases. Thank you.
I think well presented.
Thank you, sir.
Neat, clean graphics. I had a couple of questions. Did you document the other eye status? Because if the other eye is
Yes, sir.
actually, cataractous with advanced cataract, that can actually impact their mobility and
Yes, sir. Actually, we evaluated, but I have not included this in this presentation. We had evaluated around 30% of the patient had brown to mature cataract in the other eye, which made them very difficult. Their day-to-day activity is very difficult. Other patient had IMCs and some patients had PCIOL. In this study, the patients which had undergone scleral tear repairs for these patients, some patients had undergone SFIOL in the future.
all right.
So some patients we were
And
able
I forgot to catch it if you mentioned the mean follow-up period.
So mean follow-up period, we were able to follow up these patients up to 6 months,
All of them?
all of them, sir.
Okay.
Some patients 20% patients had fallout from follow-up, but other patients we were able to follow up. Some patients are still waiting for SFIL surgery, sir, so that is still to be evaluated.
Well, Dr. Akshay asked you about the fellow eye,
Yes, sir.
and you said about 30 to 35% of them had
Yes, sir.
quite a
Mature cataract and brown
advanced
cataract.
cataract. So, did you ever think of operating that eye first and then going ahead with the second eye, the traumatic eye,
For
in order to give
SFIL,
him better mobility?
so our first approach was to repair the wound. After the scleral tear repair only, if there is any vision threatening thing happening in the posterior segment like endophthalmitis or
No,
anything
I'm
like
not
that.
talking about endophthalmitis. I'm talking
Yes.
a very straight, simple question that the fellow eye has got an advanced cataract and the other eye, traumatic eye, has already been repaired
Yes, sir.
somewhere else. We are talking about the wound dehiscence.
Yes, sir.
So, did you think ever of doing the fellow eye, the cataract eye, first to give a better mobility
Yes, sir. Yes, sir. And some patients were planned for the other eye cataract surgery to give them better mobility.
beforehand,
Beforehand, as in, sir,
before doing the traumatic eye?
traumatic eye after scleral tear repair only we were taking for the other eye surgery, sir. And for the traumatic eye SFIOL, we were planning it later only. That is why some patients are waiting for
Okay,
traumatic eye.
thank you.
Yes, sir. Yes, sir. Thank you, sir.